Busted hip. The call, Sunday, 5:43 p.m., 32 Charlie. Unknown problem, man down, 66-year-old male, Charles Stupak Park, behind the Stratosphere. Vegas has several nasty locations. Both budget suites on Tropicana west of the Strip, where the Democrat prostitutes gather behind the 7-Eleven. They scream into their cell phones pretending to be talking on them. Then, when a car pulls up, they swarm it and pull up their shirts and shove their titties in the car. They pull their hot pants aside to show their pussies trying to sell it. They stick their fingers in there and let the drivers smell and lick them. Then, whichever gets picked gets in the car and drives away. Lakemead and Jones required a special crime task force assigned to the area because the Democrats that lived there were killing each other at a higher than acceptable rate. As if. Hotels like Harbor Apartments east of the Strip on Flamingo and Harmon, where the crackheads gather, use, and deal, are also on that list. Most of downtown because of the homeless, and especially Homeless Street, Main and Owens, where they live in tents lined up on the sidewalk. But Chester Stupak Park is the worst. It has prostitutes like those on Trop, crack addicts like those on Flamingo, and a few nights ago, a drug-related Democrat-on-Democrat shooting in which one of them died before 911 arrived. Today, however, Metro was on scene before us, or I would never have gotten out of the ambulance. Our patient lived on the edge of Stupak Park, and he was big. No canceling fire department on this call. Dex and I would require their lifting services in about 10 minutes. After talking with Metro, it turns out the patient was not a suspect, but we still approached cautiously. I asked what the problem was, and this guy threw his arms up and sputtered something unintelligible. He looked and talked just like Don Vito, Bam Margera's uncle. But it wasn't until he opened his mouth full of no teeth that I understood the problem. He wasn't just crazy, there was a failure to communicate. Time to unravel the situation. So I took a breath, a mental step back, and looked at the entire scene. Until a few minutes ago, this guy, heart rate 88, blood pressure 134/90, respiratory rate 1802, 92, blood sugar 88, temp 98, was in his apartment not bothering anybody, living the ghetto dream in Vegas. Now, he's leaning against a railing, weight shifted to his left leg, the right leg slightly shorter, with the foot rotated in. He, heart rate 132, blood pressure 146/96, respiratory rate 2202, 94, blood sugar 94, is muttering and flailing one arm around at me while the other is splinting, pushing on it to reduce pain, his hip. The problem wasn't just crazy or the lack of teeth. Those things can't drive up your heart rate like that. This guy was in pain, lots of pain. Either he dislocated his hip, not likely, or the femur head broke, more likely. Either way, he's crazy, and crazy is dangerous because crazy can get violent fast. And this guy was big. But that level of pain would explain that pressure and rate. Fire is on scene now. After taking a moment to watch this patient with no teeth, busted hip, and in lots of pain, me, decided on our treatment plan. I was going to give this guy a shot of morphine, which is a painkiller. We, the fire department, would wait 2 minutes, it had to be 2 minutes, before helping him walk to the gurney at the bottom of the patio stairs. And the patient insisted on walking. Usually we wouldn't allow it, but his patio was positioned weird, and everybody hated this guy. He was big, so nobody argued because nobody wanted to lift him. I told you, nobody wants to lift the fat fucks. I went back to the ambulance and got some Versed, my psych chiller, which is not morphine, which is a painkiller. Versed is more of a knockout drug. I prepared the syringe in the ambulance and I loaded it with half the suggested 5 ml dose. It wasn't my intent to pass him out, just lower his anxiety level, like heart rate 88, because he was being a danger to himself and others, which is justification for the administration. I walked back to the patient, showed him the syringe full of morphine, then administered it through his shirt. No wiping with a little alcohol pad. Also, per protocol, morphine is not allowed to be administered IM or sub-Q. But fire doesn't catch this detail because they don't know the protocols because they don't do the job. But technically, I was administering Versed, which is allowed via IM. Whoops, did I say morphine? In exactly 2 minutes, he settled down. Heart rate 84, respiratory rate 14, allowed the fire department to put a man under each arm to help carry him off the patio, down the stairs, and over to the gurney, where they carefully helped him onto it. They wheeled him to my truck and lifted the gurney into the back for us too. With Versed, neither weight nor sex is related to effect speed. Some people just go down faster. I thought there would be more time before this guy passed out, especially since I half-dosed him and did it IM. From my experience, 5 milligram Versed, the max dose, via IV, usually takes 3 to 5 minutes for therapeutic effect. Therefore, 3 milligrams IM, intramuscular, or subcutaneous, sub-Q, should take longer because of the slower absorption method. Nope, not today. This guy was going down fast, and someone from the fire department made a joke questioning how much morphine I actually gave him. After laughing with them and thanking them profusely for their most excellent service today, they cleared themselves from the scene. Fortunately, they don't care about anything other than themselves and were happy to leave. I love it when a plan comes together. I put the guy on oxygen. Dex worked him up. IV, O2 monitor, blood sugar, and pressure. Then we transported. I documented how aggressive he was on scene and the 10 out of 10 pain he was in. Then documented how he was able to successfully transfer himself to the gurney after the administration of morphine, and that he thanked me. By this time, he was so passed the fuck out from the Versed, heart rate 78, respiratory rate 10, he had snores, respirations. How could this level of unconsciousness be explained at the hospital? Morphine doesn't do that without decreasing respirations further, and if I did give him that much morphine, why didn't I just reverse it with some Narcan and never tell anybody it happened? Unfortunately, there is no opposite for Versed like there is with morphine, and coffee is contraindicated for patients that can't protect their airway. Witty banter. Since slapping a patient back into consciousness isn't allowed, I just documented he got rowdy and aggressive during transport. It would match the police report, and safety concerns are justifications for chemical sedation. Perfect. The morphine he never got went in my pocket. Thank you very much. Documented it was given on scene. Then documented 3 milligrams Versed given during transport with 2 mil wasted. Yeah, right. But no one ever asked. And it was a broken femur head. Busted hip.